Hello everyone, myself Mr. Girish Chandra Mandke from SBNM College of D Pharmacy, Mahat. Today I deliver lecture on drugs acting on blood system. In this topic, we have discussed next point is coagulants and anticoagulants. When a blood vessel ruptures, bleeding occurs, and within a short period, blood loses its fluidity and sets into semi-solid mass known as clot. This mechanism is known as clotting. Clotting means गोठणे. Blood clot means रक्त गोठणे. These steps involved in clotting are as follows. आता कोणत्या steps आहेत clottingच्या? First is when a blood vessel ruptures, bleeding occurs. First, thromboplastin plus calcium it acts on broken wall it acts on inactive prothrombin, that is plasma, and it converts to active thrombin. Then active thrombin it acts on fibrinogen, and then fibrinogen is converts to fibrin mass, and fibrin mass to form clot. This is the steps involved in the clotting process. Next, anticoagulants are pharmacological agents which when administered inhibit the mechanism of clot formation. The anticoagulants हे असे pharmacological agents आहेत की जे कशासाठी ॲडमिनिस्टर केले जातात, तर जे काही क्लॉट फॉर्मेशनचं मेकॅनिझम आहे त्याला इनिबिट करण्यासाठी अँटीकोअग्युलंट हे फार्माकोलॉजिकल एजंट्स ॲडमिनिस्टर केले जातात. देज आर क्लासिफाईड ॲज फॉलोज. अँटीकोअग्युलंट्सचं क्लासिफिकेशन. फर्स्ट, डायरेक्टली ॲक्टिंग intravenous anticoagulants, example is heparin, and second is indirectly acting oral anticoagulants, example is warfarin and phenindone. First is a warfarin and second is a phenindone. Next is a pharmacology of first directly acting intravenous anticoagulants. In that, first is a heparin. It is a naturally occurring in mast cells of liver and hence the name is heparin. आता हेपॅरिन हे नॅचरली मास सेल लिव्हरच्या मास सेलमध्ये आढळून येतं, त्यामुळे त्याला काय म्हणलं जातं, हेपॅरिन. कमर्शियल हेपॅरिन इज ऑब्टेन्ड फ्रॉम द लंग इंटेस्टायनल म्युकोसा ऑफ कॅटल्स अँड पिग्स. तर कमर्शियल हेपॅरिन जे आहे ते लंग इंटेस्टायनल म्युकोसा आणि कॅटल आणि पिगचे जे काही लंग इंटेस्टायनल म्युकोसा आहेत त्याच्यापासून ऑब्टेन केलं जातं. नेक्स्ट, मेकॅनिझम ऑफ ॲक्शन ऑफ हेपॅरिन. हेपॅरिन प्रिव्हेंट्स क्लॉटिंग इन विवो ॲज वेल ॲज इन विट्रो. And heparin with an alpha globulin, a cofactor in plasma, forms a complex which prevents thrombin formation. It interferes with aggregation of platelets. The heparin with alpha globulin, a cofactor in plasma, काय करतं, फॉर्म्स अ कॉम्प्लेक्स विच प्रिव्हेंट्स थ्रोम्बिन फॉर्मेशन. हेपॅरिन आणि विथ अल्फा ग्लोबुलिन आणि कोफॅक्टर इन प्लाझ्मा याचं कॉम्प्लेक्स फॉर्म होऊन थ्रोम्बिन फॉर्मेशनला प्रिव्हेंट करणे हे हेपॅरिनचं मेन मेकॅनिझम ऑफ ॲक्शन आहे. अँड इट इंटरफेअर्स विथ ॲग्रिगेशन ऑफ प्लेटलेट्स. प्लेटलेटच्या ॲग्रिगेशनमध्ये सुद्धा हेपॅरिन इंटरफेअर करतं. दिस इज द mechanism of action of heparin. Next is a pharmacokinetics in bracket absorption, fate and excretion. It is not effective orally. Pharmacokinetics of heparin. It is not effective orally and always administered intravenously or subcutaneously. Then heparin does not cross the placental barrier. heparin हे placental barrier ला क्रॉस करू शकत नाही. ते ओरली जास्त इफेक्टिव्ह नाही, पण जर इंट्राव्हेनसली किंवा सबक्युटेनियसली ते ॲडमिनिस्टर केलं तर ते जास्त इफेक्टिव्ह आहे दॅन ओरल रूट. इट इज मेटाबॉलाइज्ड इन द लिव्हर अँड एक्सक्रिटेड थ्रू युरिन. ते लिव्हरमध्ये मेटाबॉलाइज होतं आणि युरिन थ्रू एक्सक्रीट होतं. साईड इफेक्ट्स ऑफ हेपॅरिन. हेपॅरिन मे कॉज हिमॉर्ज, हिमॅटोयुरिया. द नेक्स्ट, प्रिपरेशन ऑफ हेपॅरिन. हेपॅरिन 10,000 to 12,000 UV. Then 800 U per kg by IV or subcutaneous route. Then the contraindications of heparin. Heparin is contraindicated in the following conditions. First is a peptic ulcer. The next is a hemophilia. In this situation, the blood clotting is not formed, so the heparin is also contraindicated in this situation or condition. Then next contraindication condition is threatened abortion. These conditions are also contraindicated heparin in this condition. Next, second, indirectly acting slow anticoagulants, coumarin derivatives. Coumarins are effective only in vivo. Coumarins act as anticoagulants in the following way. First, coumarin competitively inhibits vitamin K in liver. Coumarin हे competitively vitamin K ला liver मध्ये inhibit करतं. Then coumarin suppresses the synthesis of prothrombin and factors essential for clotting like 7 proconvertin, 9 Christman factor and 10 Stuart Prover factor. Then third, thus it prolongs time taken for prothrombin action. This is the coumarin indirectly acting slow anticoagulant. The next, pharmacokinetics of coumarin derivatives. When administered, they are readily and completely absorbed. जेव्हा coumarin derivative administer केले जातात त्यावेळी ते readily आणि completely absorb होतात. These agents cross placental barrier and may be secreted in mother's milk. हे जे coumarin derivatives आहेत ते placental barrier ला क्रॉस करतात आणि मदरच्या मिल्क मध्ये सिक्रेट होतात. And it is metabolized in liver and is excreted through urine. The side effects of coumarin derivatives: hemorrhages in main drawback. Hemorrhages is a main drawback. Then preparation: warfarin sodium, trade name is univarfin, doses 10 mg daily by oral route. Then pendion, doses 50 to 150 mg per daily. Then therapeutic uses of anticoagulants. First therapeutic use of anticoagulant is to treat venous thromboembolism, means destruction of blood vessels by a blood clot. Then to treat arterial thrombosis. Arterial thrombosis means clotting of blood in artery. Thrombosis means clotting. Then to treat pulmonary embolism, means clotting in pulmonary vessels. That is. The next, in acute myocardial infarctions, means heart attack due to clotting in arteries or veins. The next, in atrial fibrillation and during vascular surgery. This is the therapeutic uses of anticoagulants. Okay, thank you. We can stop.